What'd you see happen there? Yeah, guy fell asleep driving his car, got into an accident. So we're going to talk about residency and sleep. This becomes a very important thing for you guys because it actually protects yourself, protects your patient, and protects everybody around you, and protects your career. So this talk that I give was actually based off of what's called the SAFER curriculum, which was basically put together by the American Academy of Sleep Medicine. I'm not actually a member of the American Academy of Sleep Medicine, but you could be. So you're going to ask, why? Why am I here? Why are we having a lecture on sleep? Why don't I just go back into the back and curl up and sleep for an hour and that'd be good? Well, the thing is, come on, sleepiness in residence, you'll be very happy to know that you're almost narcoleptic. Okay, so basically you're somewhere between sleep apnea and narcolepsy. Okay, so now let's see, what can we do about this? Well, first of all, is there anybody neurosurgery residents out here? There you are. Hi. Sorry, you're not going to sleep. Okay, so sleep deprivation and neurosurgery residents are probably the highest. OBGYN is also up there, general surgery, orthopedic surgery. And if you're doing orthopedics at SLU, definitely you won't get sleep when you're on call because all you're going to be doing is coming down to the ED or doing consults other places. So does anybody know who Libby Zion is? This is a very important thing for you to know. So Libby Zion actually checked in to a hospital up in New York. She had a history of depression and she was on Nardil. She was sick and she was in the ICU, and a resident saw her. She was complaining of more pain and she was getting very agitated. So she got Demerol. Is that a problem? Is that okay? Okay, well, it's not okay because Nardil is an MAO inhibitor. Anybody know about MAOIs? MAOIs plus Demerol, which there's no Demerol out there now, but MAOIs plus Demerol can put you into a crisis. And once you go into a crisis, you can die. She died. The thing is, if you look at the time frame when this happened, this was in 1987. The description of MAOIs and their interaction with Demerol and other medications wasn't well described. Her dad, this is Sidney Zion right there. He was a lawyer. He was an editor for the New York Times. He basically got this put on 60 Minutes. He got it put on all over the news, and basically said, "Look, you got to be stupid. The person that was taking care of her was up for 60 hours straight. There's no reason why a resident should ever work that much." And that got, I think the resident that got charged with this got charged with like 18 crimes. Now, I will tell you that all those got dropped. And the Medical Board of New York basically said, no, this is baseless, that this isn't something that whatever. But because of this, they came up with the Libby Zion law, which is basically why you have duty hours. Did you know that? Now you know. So what is sleep? Okay. So this is what you got in med school, right? You go in, you start at the various levels of sleep, you fall asleep, you get stage 1, stage 2, stage 3, stage 4, and you work your way back up and you go into REM sleep and you work your way down again, you work your way up again. If you notice, your time in REM actually gets longer and longer as you go throughout the day, okay? But your time in deep sleep or restful sleep is actually not as much. There are two things that cause you to sleep. One is their circadian rhythm, process C. That's in your hypothalamus. It's preconditioned. It's approximately a 24-hour cycle, and it goes up and down. Everybody's heard of circadian rhythms, right? So it goes up and down, and that actually keeps you awake, okay? Then you have process S, which is the sleep drive. Sleep drive kind of goes up, up, up as you wake up. As you're up more, up more, up more, up more, you got more drive to sleep. What's interesting is process C comes down, process S is at its maximum, and that's when you fall asleep. Kind of interesting. You're like, well, good. How much sleep do you need? When you're a baby, you need a lot. If anybody's had a newborn baby, they just sleep, they eat, they poop, they sleep, they eat, they poop, they pee, sleep, eat, they poop. That's what they do, okay? As you get older, it goes less and less and less, okay? To where you're kind of up here, young adult, 7 to 9 hours is about what you need. You're like, well, but I can do more. Well, let's talk about that. So first of all, insomnia. So if you don't sleep, the drive to sleep is actually you could consider this like on a ventilator, you have drive pressure. It's the difference between your process S, or your sleep drive, and your circadian rhythm. The differences between it increases your drive to sleep. That's why if you can sometimes battle through, you're like, oh, I've been up for 24. And then it gets to be middle of the day and you're like, oh, I'm pretty awake now, right? That's why, because your processes are closer together. But then later on that night, when you haven't had sleep for 24 hours, you're like, I'm dying, right? That's why that happens. Okay, does that make sense? Okay, cool. So what about being on call? So when you're on call or you have a baby, any new mothers? Anybody have kids? You wake up in the middle of the night, okay, I need food. Okay, that is going to give you these little things in your sleep. But as you notice, restful sleep goes away. This stage 4 sleep, you never actually get to it if you keep getting woken up. Okay, and that's a problem. Okay, and that's the problem with call. Now, what are common sleep deprivation symptoms? You're cranky, you're moody, can't concentrate, you may have GI upset, you may have memory problems, you have paranoia. A lot of different things happen. It's very interesting. You're like, oh, did I lock the door? Oh crap, I gotta drive all the way back. Okay. That is not because you didn't lock the door, it's because you're not concentrating, you're not really picking up on what you're doing, and you're a little more paranoid. This is a prefrontal cortex. These are functional MRIs. So when you take someone that's very relaxed, you have nice, normal thought processes and normal things that are going through your prefrontal cortex, which means you can stay awake, you can make good decisions, you can decide not to put your whole paycheck on the lottery and think you're gonna win, okay? Versus if you're an insomniac, this is the guy that's going, yeah, skydiving without a parachute, that sounds kind of cool. Yeah, that's not what you want to be. Now, what about lapses in attention? So as you have more and more days of sleep deprivation, and it's not necessarily days without any sleep at all, it's like not enough sleep, you have more and more lapses of your attention span. How is this important? You're putting in a central line. Oh shit, I forgot to get the air out of the syringe. Oh shit, I forgot to pull the wire when I floated the central line, and now I have to call CTS to go get that wire out of them. Okay, so attention deficits, it's a problem, right? More and more sleep deprivation. What about drinking? Okay, nobody in here drinks, right? I saw everybody at the reception last night. You don't drink, but if you were to not drink, and you were to drink, and you were to drive, it's like being drunk if you get sleep, certain amount of sleep deprivation. And it doesn't take a lot. 21 hours without sleep is about the legal limit, okay? Anybody here fly a plane? Anybody here flown a plane? Sure, you don't want your pilot to be sleep deprived, right? That's why they can only fly for 10 hours. I have a friend that's a pilot for FedEx. He can only fly for 10 hours. Once he hits that 10 hours, he cannot fly. And there's a reason for that, and we'll talk about that. Now, what are the physical effects? There's a whole bunch of them. You're more likely to get sick. You're more likely to have GI problems. You're more likely to feel cold, more likely to get diabetes, more likely to become obese. You're more likely to have decreased libido, blood pressure is going to go up, increased risk for heart disease, all these things, bad. Sleep inertia, give you an example. So I'm in the ER. see a patient. It's a guy that has liver disease. He's got Hep C cirrhosis. He's got a MELD score of 30, and he comes in vomiting blood. And you call the GI fellow and go, "Hey, GI, yeah. I got a guy, Mr. Smith. He comes into the ED. Yeah, he's vomiting blood. His blood pressure is 80 and his hemoglobin's 5, and he's vomiting blood." And the GI fellow goes, "Okay, I'll see him tomorrow." Any good GI fellow or GI attending would be like, "Yeah, I'll be there." Be pissed because now he's got to wake up and he's got somebody that's really sick that he's gonna have to do an endoscopy for, or put a Blakemore tube in, or do something. But now because of sleep inertia, he totally blows by it. It's that little bit of lag. Sleep inertia, if you haven't experienced it, probably will. I haven't seen anybody do this, so I must be doing a good job. But this is how you are in lecture, right? Okay, I remember doing this a lot in college. I remember doing this in med school. But now, since med school is all online, most people don't get that. But you're not off. You miss things. You miss things in lecture. You miss things about what's going on. Now, Jimmy Fallon would be like, so the thing is, let's do this. Has anyone ever seen this? Okay. I was in high school when this happened. I remember sitting in social studies. We're like, "We're going to watch the launch. This is going to be such a great day." And then we were watching, and all of a sudden, boom! We're all like, "Why did this happen?" Does anybody know? Yeah, it was O-rings. Okay, and what was wrong with them? No, they weren't the incorrect ones. They knew they were bad. They knew they were bad. They thought they could get away with it. They were sleep deprived. The people that had been working on it all night long. And this launch was supposed to happen. And so they basically had this, they had this flight that's billions of dollars. This isn't a small change, that if they would have said, "No, we need to stop. We need to get these replaced and then do the flight later on," this wouldn't have happened. This is sleep deprivation. Sleep deprivation caused this. Now, there was a physical, mechanical problem with the space shuttle that caused it, but they actually recognized it before it happened, before the launch. And they recognized it the night before. The other things, Exxon Valdez, now he was drunk, but he was also sleep deprived. And then, you know what that is? Anybody? Chernobyl. Okay, so Chernobyl happened at like 2:00 in the morning when it melted down. Okay, 3 Mile Island melted down 2 to 3 o'clock in the morning. So what are the consequences? We're going to kind of go through all of these. Okay, so impact on professionalism. Give you a story. So I was on Ped Surge. Okay, I was a first year resident, just like all of you guys are, or most of you guys, gals. So I was on Ped Surge. So the way that Ped Surge worked is that we had call every other night. So you would do call 24 hours. Then you would be on call till 8 in the morning till the team came in and you did rounds. And then it was your duty to do all the pre-ops for all the things going to the OR that day up until noon. So you were there from 8 in the morning till noon the next day. And then you would flip it and do it again. So about 4 or 5 days into this, I am doing Ped Surge. So I go in, I see this family, and I'm like, "Yeah, so your son, yeah, he's getting a Kasai procedure. Yeah, here's the risks and benefits. And can I have you sign this?" The mom goes, "So what is a Kasai procedure? I'm like, I have no idea. And then she goes, so what are the risks? I'm like, bleeding, death. And then she goes, nurse, get him out of here. So I had to go sit in the director of the department chair of pediatric surgery at Mercy Hospital in Kansas City. I had to go sit in his office for 2 hours to have him yell at me about this patient and about the mom. If you don't know a Kasai procedure, anybody know? What is it? Biliary atresia. And what do? Yeah. So they bring bowel up and just basically adhere it to the liver. And what it does is that the biliary ducts actually not morph into, but they start to drain into the GI tract, and they do fine. Now, what's interesting, it's like things in medicine. How did the Kasai procedure come about? The guy was doing surgery and the kid was about to die. And he's like, shit, the liver's bleeding. So he sewed the bowel up to the liver, put the kid in the ICU, and the kid lived, and his biliary problem went away. I'm like, oh crap, we just figured out a cool procedure. So yeah, that's what professionalism can do to you. Okay, so now what about you personally? Do you like getting stuck with dirty needles? There you go. Medical error. Okay. Car accidents, percutaneous injuries, extended shifts greater than 24 hours. Much more likely to get a needle stick. Factors for needle sticks: lapses in judgment, fatigue, inadequate lighting, all these things which could have been avoided just by getting a little extra sleep. Medical errors without consequence. Okay, so you missed one dose of meds and it's really not going to cause a problem. Okay, fine. Okay, so those go up. Then you're like, with consequences, wait a minute. Those go up too. Wait a minute, they go up quite a bit. And what about the chance of dying because of a medical error? Goes way up. Because it's easy. So okay, back to my residency. I was working at Children's Mercy in Kansas City. And there was a patient that was supposed to get, oh shoot, what was the name of the drug? I can't remember the name of the antibiotic, but instead of getting the antibiotic, they got Pavulon. What was Pavulon? Pavulon's a non-depolarizing neuromuscular blocker. The kid stopped breathing and nearly died. Why? Because the nurse kind of looked at the vials, kind of like, oh, whatever. It was over a night shift. Mistakes happen. Okay, now extended shifts and car accidents. This is amazing. So if you think about it, you don't want to be sleepy when you're driving in your car. Okay, you're putting yourself up for risk of dying when you go home. And what's all this worth if you're dying when you go home? Even surgery actually thinks it's a problem. It's crazy, right? Because surgeons, tough surgeon, I can go without sleep. No, it's still a problem if you're a surgeon. Now, I think I have a different slide about this, but what do the courts think about sleeping and driving and getting into an accident? Is it just, oh, it's just an accident? They will actually find your duty hours. They will come and find your duty hours. They will look and they will say, you were in the hospital for 26 hours straight and you hit a pedestrian crossing the road and killed them. Your fault, and it's reckless homicide, and you can get, a felony on your conviction rate, right? So, learning. If you are up for a whole night shift and you come in for a lecture, are you really gaining anything? Really? You're kind of sitting there nodding. You're maybe trying to get your charts done. You're maybe trying to do whatever, but you're really not gaining much by doing that. And actually, there's studies that actually show this. We know that you stop learning after 12 or 13 hours. Now, my residents in my residency program, they work an 8-hour shift overnight. They will come and work, they'll come to lecture for 2 to 3 hours at maximum. They can go home, go to sleep and do it all over again. But the reason why we do that is because of this. Because once you start getting sleep deprived, your goal in life is to survive. Your goal in life isn't to learn. Now, specific things on data. Internal medicine basically says you can't do simulation on critical patients very well. Surgery, you have there's a effect on surgical performance. Emergency medicine, if you're sleep deprived, you're not going to do as well on the ITE. And OBGYN, they do things. They did a study on fine motor stuff in the sim lab as well. What that one was from. What else? Your involvement in a malpractice suit goes up. Your overuse of medications to stay awake, like Provigil or something like that, goes up. Accidents, serious medical error, conflicts with other residents, conflicts with nursing staff. Okay, so now this one's put at the bottom. I find that this will make or break your life wherever you work. If you make the nurses mad, you make the nurses angry. The nurses don't like you, you will not have a fun residency. Why? Because they have been here for who knows how long, 10 years, 5 years, 3 years. They're not going anywhere, but you are. You're here for a couple of years and then you leave. They're more worried about their job and the patients than they are about you. If they know that you're on their side and that you will help them out and that you will be a good resident and take good care of patients, they can be your best friend. And they will help you and they'll be like, hey, you made a mistake on this, fix it. Or they'll be like, hey, this person's vital signs just became abnormal, and they'll come up to you right away. Okay, so be nice to the nurses. So what's the strategy? Power through. That's it. Just power through. That's the best way to do it. No, that's okay. So healthy habits. So make your sleep non-negotiable. Make your sleep non-negotiable. You get sleep. You have to figure out what works best for you, but you have to talk to your spouse. You have to talk to your friends. You have to talk to people that are around you. If you have young kids, you're like, hey, daddy's going to play with you tomorrow morning, but I have to sleep now. Okay, this is really important. Okay, make it non-negotiable. Recognize that your sleep needs are important. Recognize that you have to have a routine for your sleep and when you sleep. Develop a pre-sleep routine. Some people like taking a shower. Some people like drinking a cup of milk. Some people like little pool thing, whatever. Some people like whatever, but whatever works for you works for you. And if you're working night shifts, think about maybe taking a little bit of nap before you go to work on your first night shift, because that way at least you have a little bit, and then you can get more after your night shift. Plan for these things. Cooler rooms, darker, quieter. Don't go to bed hungry, but don't pig out right before you go to sleep. Okay. Avoid heavy exercise. I will say I break this almost every other night because I work out at the gym from between 9 and 11 o'clock at night, every other night. And that's when I work out, and that's just the best time for me. And the gym is empty, so I can do whatever I want to. But it still works for me. Facts. Exercise makes you sleep better. I find the exercise that I do, because I do it at night, helps me sleep. If I don't exercise at all during the day, I feel like crap. Okay, or I don't sleep well. Non-exercisers are the sleepiest and have the highest risk for sleep apnea. Why? Because you get more weight, you have decreased ability to clear your throat. Less time sitting is associated with better sleep and health, and exercise at any of the time of the day appears to be good for sleep. Okay, that's good. So you are a resident, but you are also a human being. Can you have sleep apnea? Sure you can. Can you have narcolepsy? Sure you can. Can you have some disease process that's causing you to have problems with your sleep? Yes. If you do, see a doctor. Okay? Don't try to treat yourself. Say, I can't sleep. I need help with sleep. Go see a doctor. Maybe they can do a sleep study. They can do other things to maybe diagnose one of these other sleep problems. All right. Okay. Napping. Everybody likes a nap. Okay. Naps are good. Okay. Nap. Nap should be short, 15 to 30 minutes. You remember the sleep cycle? I didn't point that out, but it's 90 minutes. Okay. If you're going to not do a short sleep cycle and you're going to sleep, don't sleep for an hour. Sleep for an hour and a half. Why? Because you go through a full sleep cycle. And if you go through a full sleep cycle, you wake up and you won't have sleep inertia. Okay. Can't always do that, but a nap doesn't really replace a good night's sleep, but it is helpful. And then this is the idea. So you want to do short. You really don't want to do the 30 to 60. That's usually not quite right for most people. What about better living through chemistry? So alcohol does not help your sleep. You might be like, yeah, but I drank 1 Guinness and I can sleep like a baby. Well, that may be true, but your sleep cycle gets screwed up because of it, okay? The other thing is melatonin. Has anyone used melatonin? Okay, what do you think? Good? I like it for trips. Like if I fly to Europe, I take melatonin. Why? Because it helps reset my sleep cycle. Does that thing in my thalamus, and my thalamus likes it, and it goes, hey, I can reset you. And then I go for a run, and then I'm usually pretty good by the second day, right? Versus some people go on a trip to Europe for a week and they're groggy for 3 or 4 days, and then they're like, I'm having fun. Oh shit, I gotta leave. Okay. Starbucks, we'll talk about caffeine. Trazodone. If I was going to use a sleep medication, trazodone would probably be the one to use. It's non-addicting. It does a pretty good job of putting people to sleep. There are some side effects that can happen, but that's probably the least addictive. And then Ambien if you really need it. Caffeine. So I did Caffeine Anonymous. Hi, my name is Dr. Kraus. I used to drink 3 monsters every shift. 160 milligrams of caffeine per monster, and I did 3 of them. So I was doing 420 milligrams of caffeine per shift up until about 8 months ago. I haven't had a drop of caffeine since. But caffeine, if used appropriately, is good. Is good. I am not saying caffeine's bad. I just decided I didn't want caffeine anymore. But caffeine used in moderation can be a good thing. Use it at the beginning of your day. Use it at the beginning of your shift. Don't use it 4 hours before you go to bed because it will still be in your system and you'll have decreased ability to sleep. Okay? I will say that I was not nicotine. I don't do nicotine. I was a caffeine addict. At one point in med school, I would go to a place called the Grind, which was over in the Central West End. I would drink 3 or 4 espressos and go to bed 15 minutes later. It was amazing. Now recognizing it in others. So now you have the thing to do to yourself, but you can recognize it in other people. You can see it when the person is nodding next to you. You can see the person that's not coming up with questions or answers that they would normally come up with. Make sure you take care of your colleagues. If they look like they're sleepy and you have the ability to say, hey, why don't you go take a nap for a second? I'll cover the floor and then we can get this taken care of. Or, hey, why don't you call the program director? You look like you shouldn't drive. Okay, let's get you a free ride home. Okay, or instead of going home at the end of your call, let's have you just go into the call room and get some sleep. Okay, find what you see in others. This is what I talked about before. This is, so again, for truckers, pilots, nuclear power plant workers, they have time that you can't sleep or time that you have to have sleep. We talked about the Livy-Zion rule. Now, ACGME requirements. What are your requirements? Has anyone looked at the Common Core requirements for ACGME? Peruse it. It is the thing that's guiding my job as a program director. And everybody, there's a standard list of Common Core program requirements for every residency out there, but there are also ones just for emergency medicine. There's ones just for internal medicine, for vascular surgery, for neurosurgery, for OBGYN. There's a certain amount of things that they are required to do for you and to provide you, and things that they have to work inside of. Please look at that. We have to do this lecture. This lecture is actually a requirement. Check. Okay, so mandatory time free of clinical work. There are things for that. Residents must have at least 14 hours free of clinical work and education after a 12-hour in-house call. Now, for emergency medicine, that's an equal length of time of the shift afterwards. So, which if you work an 8-hour shift, you're supposed to have 8 to 10 off. Okay, kind of how that works. And then some of the things are not necessarily tied to lectures. So like if you do a lecture for 8 hours, then you go to lecture for 4 or 3, then that's 11. You don't get 11 hours off, but you get 8 after that. That's allowable. Okay, protect your sleep. Consider splitting up shifts, use night float. Almost every service in the hospital use night float now. There are very few services that do a full call and then you come in and work the next day. There are some, and some of those are actually at-home call, so they don't get called as often. Let's see, scheduling principles. If you use the circadian rhythm right, if you're a scheduler, you can make life better for your residents. Chief residents do what they have to do. So when you look at your schedule and go, hey, Dr. Krause said you were supposed to use circadian rhythm. Well, they do what they do what they do, they do what they try. Okay. Let's see. Uh-oh. Okay, high risk procedures. The last thing you want to do coming off being an intern is be like, there's a central line, and I don't get to do it. If it's at the end of your shift and you're really tired, the person coming on will do that procedure for you. However, it's a rectal exam. That's not a high risk procedure. Sorry, I understand, but that's not a high risk procedure, okay? Drowsy driving, you do realize that if you need a ride home and you're sleep deprived, you call your program director, we can get you home, okay? There are call rooms as well, so make sure you know that. The basic rules of medicine is eat when you can, sleep when you can, and don't mess with the pancreas. Still applies today. Okay. Oh, geez. Messes with my timing. Okay, in summary, fatigue is an impairment like alcohol. It is drowsiness. I'm not going to tell you by doing this lecture, you are now never going to be sleep deprived all of residency. That's not the case. But I'm giving you tools to mitigate that a little bit. And if it interferes with what you're doing, please talk to your program director. Patients have the right to have a healthy, alert, responsible and responsive physician. And that's even from the American College of Surgeons. I don't know why this is. Okay. And this next slide was amazing. Just kidding. Okay. After all the stuff that I just told you, right? This was a study put in the Archives of Internal Medicine in 2007, which basically says, under the current duty hour regulations of the ACGME, residents continue to be sleep deprived, and the lecture that I just gave you has no impact. How about that? It has no impact because if you don't take what I take from this lecture, something to use or some way to mitigate your sleep or sleep deprivation, it won't work. If you come up, most lectures, if you just sit through them and do whatever, it doesn't do anything for you. If you use some of this stuff, it'll help you. Just be cognizant of what you're doing and why you're doing it, because it does make a difference, okay? And remember, you have people on that you're taking care of, and would you want your family member to be taken care of by someone that was not at their 100%, okay? The resident survey. So every February, well, end of February, March, going into April, first week of April, you'll get a resident survey. And it's going to say, how was the work environment? How was this? How was that? And there'll be one question that says, did you get a lecture on sleep and fatigue? Bingo, did it. Please mark that one as that you did, that we actually got it. And that is the end. Any questions? Yeah. Exercise. I work out. So last night was a short night. I did an hour and a half of sleep, hour and a half of exercise. I work out for about 2 hours a day, a little bit less sometimes, but I try to exercise and then I try to sleep. So if I sleep and I get exercise, I wake up and I'm fine. It's the days that I don't exercise or I don't get enough sleep that I'm a problem. But I really try to do that every day. I really try to get the sleep. Now you gotta say, well, I'm a resident. I'm not gonna be able to do 2 hours of exercise every day. But it doesn't have to be 2 hours of vigorous exercise, going to the weight room, getting on the treadmill, getting on the Peloton, doing whatever. It is going out for a walk. It's not sitting there on TV going, nothing on today. But you know, getting out, doing stuff that will help you. And I find that if I do that, I don't need I don't need the caffeine. And actually, I find I have more energy now than I did 6 months ago. Anything else? Okay, am I the last one? Break. Okay, there's more, they put more food up there. I know that's something that you guys really love, but they put more food up there. So take a break, walk around. There you go.
And the microphone.
You don't need this.
Wonderful as always. Thank you again. Yeah.